Is your teen suddenly losing their ability to speak, but brain scans and all kinds of tests are coming back completely normal? What if I told you that there is a hidden cause that most doctors are actually missing? Look, I have seen countless teens who are in the same shoes with this sudden speech loss only to be dismissed by doctors who can't find anything wrong. But I am here to tell you that the real reason might be something that cannot be seen on a scan or any kinds of tests. In this video, we're going to walk through and then break down why speech loss can happen even when the tests show nothing at all, and how understanding this hidden cause could change everything for your child. So, what exactly happens when a child suddenly can't speak or lose a voice, and why is it so confusing for both parents and doctors? It's like this. Your child might experience speech loss in different ways, like it could be stuttering, difficulty finding the right words, or even complete loss of voice. But what is happening behind the scene isn't always what you expect. Here's the deal. When a child has trouble speaking, it's often mistakenly brushed off like something really minor, like, oh, it's the developmental phase, or oh, he's just nervous, it's just a stress and anxiety kind of thing. However, sometimes it's much more than that. Speech loss can be a functional symptom of a deeper issue. So if your child is struggling with speech loss that is so sudden, and it's really critical to understand that this might be linked to a neurological condition, not just stress or anxiety, just so you know. And it's not something that shows up in a typical scan or test. So how is it possible, you might be thinking, for a child to have speech problems but show up with normal brain scan and other kinds of tests that you can imagine? Well, here's what doctors often miss. When brain scan like MRIs and CT can come back normal, it doesn't mean that there's nothing wrong. I mean, you know this already. You know that your child's not making things up, and you know your child is really struggling. However, nothing shows up, right? So for many families, maybe just like you, this is where the real struggle happens and begins. When you know that your child's symptoms are real, however, test does not show what is actually happening. The key here, though, is to understand that brain scan cannot always detect something called Functional Neurological Disorder, short for FND. FND is a condition that breaks down the communication between the brain and the body. So the communication network is basically broken and it's not working properly, which cause issues like speech loss without any physical damage. That includes brain damage or body damage. So if the brain scans don't show anything, I would say don't stop there, okay? Ask about FND and how it could be the real cause for your child, because I've seen it one too many times. So if you're aware about FND, just like what you're doing right now, this knowledge could change everything for your child diagnosis and the recovery path. And here is why doctors often call speech loss in teens anxiety or stress, or like really brush it off, like it's a teenager thing, or it's just like nervousness, something like that. And why that is not always the case, because it's really frustrating. You go to a doctor and then explain what's happening with your child, and then the next thing you know, the doctor is telling you, oh, it's just a stress. Well, there's nothing we can do. You just go see a therapist, right? So it's really stressful. And here's the truth. The symptoms are real. And yes, there might be some stress and anxiety going on with your child, but if the diagnosis is missed, then obviously you're sent to the wrong place. And here's a problem that I see all the time. So the problem is that many conventional doctors, including the ER and primary care and neurology, it doesn't necessarily matter. Many conventional doctors are actually taught to diagnose based on what they can find and what they can see on a test. That is a clear diagnosis of rule in, rule out, right? So if nothing shows up, physically speaking, then it's easy to default all of these things are caused by psychological. Therefore, your child's speech issue is coming from stress or anxiety or trauma or whatever that is, even though that is not always the case. So as a parent, it's really important to question these diagnoses and ask the doctors to clarify how they got to the diagnosis, rather than, well, we can't find anything on the scan, therefore it must be psychological kind of thing. So now that you know that your child's speech loss can be related to functional neurological disorder, short for FND, you have a right to ask the doctor, hey, could it be FND? Could it be a functional neurological disorder? So then you have better understanding that leads to the right recovery path. So what happens when speech loss is actually related to FND? Well, let's explore how this condition can impact your child's speech and communication. As I mentioned, FND is a real diagnosis, and it is essentially a communication breakdown problem between the brain and the body, even though your child's brain and body are physically and structurally a-okay. And that literally sends a wrong signal or improper signals from the brain to the body, including the muscles used for speech, or it could be the thinking that comes up with the words when they are speaking. This can result in everything from stuttering to complete loss of voice or losing the words. And here's the thing, this is not something that can be fixed by just talk therapy. I mean, no pun intended. However, the fix for speech loss is not just about talk therapy. And here's why. Because FND can be caused by a mixture of biological/physiological and psychological or emotional and social. What we call it biopsychosocial model. So it's always more things happening than you might think. So it's never ever just one thing that is causing this speech loss in your child, when in fact it's related to FND, because FND does not get triggered by just one thing. So once you understand the FND and its nature, then you can start addressing brain-body miscommunication at its root, not just masking the symptoms by working on the muscle when it's not about the muscle itself, when it's really about the brain body miscommunication. So if your child is diagnosed with speech loss because of FND, then the good news is the recovery is possible. Doesn't make it any easier, but recovery is definitely possible. With the right approach, with the right guidance, the chance of your child getting better completely is really, really good. So what do you do when your teen suddenly loses his speech, but nothing really shows up on the test or scan? Here's a crucial steps to take. Number one, ideally, you want to find a specialist who understands FND, but that is really, really hard to find. Therefore, to me, the real first step is for you as a parent to understand the possibility that your child might be actually having something called FND, and find a doctor, it could be pediatrician, family doctor, or neurologist preferably, to ask the question, hey, I just learned about this thing called FND. Can you tell me more about it? And then who is familiar with FND, so we can talk to the person in more depth. Because the speech loss isn't going to show up on an MRI or EEG. However, the neurologist can educate you about FND and how that is different from other conditions like epilepsy or stroke or something like that. And number two, this is more important, early intervention. I cannot stress enough, the sooner you get the diagnosis of FND, the sooner you accept the diagnosis of FND, and then sooner you start the recovery path, the chance of your child completely resolving from FND is really, really high. And it's already proven scientifically. I'm not making things up. It is for real. And I've seen it one too many times. So once you get the diagnosis, your job is to just move forward towards recovery. And as I'm saying all the time, don't give up. There is hope. By taking action, you as a leader, and finding the right specialist, you can actually move the needle and then help your child get their life back and your life as well. And if you think your child might be experiencing FND, again, don't wait. Start your journey to recover today. The best time to start the recovery was when your child started having the symptom. The next best time to recover is literally today. Click the link below to watch the video and learn how to begin supporting your child for real so you can move the needle, because this will give you a clear understanding of what FND is and what exactly you need to do as a next step to help your child get their life back. Thank you so much for watching this video, and I will see you in the next video.